There's still a lot of faces here hanging to the ends, and I hope there are still as many back home. As we enter this last session, we've heard a lot today from scientists. Many of us scientists have spoken about politicians, and there are those few that can combine being a scientist in a heavily intense political environment, and they have a unique chance to make a difference. And we've invited to give this last video intervention exactly one of these persons, someone that has a scientific background, but sits in a place where he's perhaps privileged to make a difference. So it's my pleasure to introduce a friend, Dr. Keith Sumption. He is the Chief Veterinary Officer for the United Nations Food and Agriculture Organization in Rome. Keith is a veterinarian with a background in ecology and has spent more than 20 years in Africa on the interface exactly between wildlife, livestock, and the environment. He's perhaps, for those that are in the veterinary world, best known for his role in leading the Foot and Mouth Disease European Initiative for several years. And he has now, for the last 1.5, almost 2 years, been both the Chief Veterinary Officer for FAO, also the head of the animal health program at FAO, and last but not least, the director of a new center on zoonoses and AMR, which has been established in Rome, where they are combining that center with Codex, and under that center we will also have One Health. And we have challenged him exactly to talk about what are the challenges and the possibilities to implement One Health.
First, a very big thank you to Carlos and the committee for inviting me here for this day, and what a day it's been in terms of the presentations. It's a challenging subject that you gave me. Normally, I would speak about the role that FAO plays with its partners in improving animal health and One Health mostly in countries which are low and middle income. But here we've take our view a little bit wider than that and look at the relevance also to the world situation. Now, where we are at the moment in 2021, we've been knocked a bit off course in terms of developing and meeting the Sustainable Development Goals, and that will have long-term consequence. But sustainable development is what One Health really is about. FAO's program, as it's developed for the next years, really looks at 4 areas, 4 dimensions: better life, better production, better nutrition, and better environment. And with 20 priority programs to be rolled out across the world. One Health is one of those, but One Health is also very important, really across the board, as a contributor to the work in the environmental area, in terms of better life, and in terms of better nutrition. One Health, in the context that I'm using it in the development of our program, is probably even broader than most concepts of One Health, because we consider that the health of our agri-food production systems, including the productivity of livestock and plant protection and plant production of our forests and our aquaculture, they're all affected by health concerns, often by the same drivers that are affecting the health in those systems. And there's often a linkage between those domains as well. Now, FAO, in terms of dealing with large epidemics of transboundary plant and animal diseases, sees these emergencies on a daily basis. And so one area of our work is very much to reduce the frequency of that. But we have to think broadly. All of these are part of our agri-food systems, and agri-food systems really affect all of us. One Health is an integrated, unifying approach, as I'm sure you've heard today, that recognizes all these interconnections. Agri-food systems are the things that connect us between the production systems and the food that we eat, from the farm to the fork, from the bush to the bowl. And those systems are impacting and impacted by the health in our humans, in our animals, in our plants. Now, how do we begin to start to apply the One Health approach in such complex value chains? How and where does One Health add value? I won't be able to give you those answers, but we have to ask these questions about the applications. We're having to re-examine what we call One Health and understand how to apply it. And increasingly, what is coming out of those discussions on the concept of One Health is an importance of recognizing the equity between sectors and disciplines, the importance of parity, the importance of a socio-ecological equilibrium, the important role we have in stewardship, and the importance of reaching sustainable solutions, recognizing the importance of animal welfare, the integrity of the ecosystem that we have and which we produce and live, and the transdisciplinary and multi-sectoral collaboration that's necessary, most of which you've seen today. Essentially, it's a search for solutions that to complex problems in a way that we can't tackle individually and through one discipline or one sector. That in those solutions takes into consideration the linkages. So we're really thinking a lot about how we're going to apply that to ensure a sustainable development in our food systems. And our Director General has really indicated his commitment of the organization in this area. Working together, the tripartite, together with UNEP, have been drawing up this year a global plan of action for One Health, considering the added value of where working together as 4 agencies can bring the unified approach at the country level, as well as up at the global level where we need tools and approaches that will help us with these areas. And these are not all the areas of One Health, but these are areas we recognize we have to work on together to strengthen the collaborative capacity. We need to promote health and healthy systems, to mitigate the risk of emerging and re-emerging zoonotic epidemics and pandemics. Huge amount of work every day goes on in that area. Where can we add value better by working together, particularly at country level? How do we tackle those neglected zoonoses, many of which are really high burdens for rural populations in lower middle income countries? How do we mitigate the food safety risks right across the food chain in a One Health approach? How do we deal with antimicrobial resistance, which is a silent pandemic and where the actions are needed in all of our sectors, including the environment? And how do we properly embed the environment dimension into One Health actions? Those are the things we're considering, how we will work better together in the global plan of action for One Health and apply it at the country level. One Health in the end isn't about things we do thousands of miles away in places which are less well off than where we're sitting at the moment. It's about adding value, and of course we have to add value because that's the basis of all the jobs that we do. But the values that we have to consider in One Health are often multidimensional, and that makes it complex. Beyond disease control itself, there's also the need for that to be paid for, to have an economic return which is worthwhile either to the producer or to those who are paying for the outcomes. We have to take into account the trade-offs relating to the environment, and there will be also the social area as well. So there's a complex value optimization which sometimes is baffling to consider. If it works at one level, if it adds health, it probably is One Health, but it may have trade-offs that do affect in another area. Sustainable development has these 3 dimensions: economic, social, and environmental. One of the good things about One Health is it does at least consider multiple domains of sustainability in its approach. One way we can also consider to apply One Health is by making it part of everything we do. If you're involved in developing projects and programs, then consider what's the One Health angle that is appropriate for the project and program. Ensure you do no harm, preferably do good in multiple areas as you do that project. And that matters because a lot of projects have their primary aim to do with, for example, ecosystem restoration or agribusiness development. And then we have to ask, was there an assessment of the One Health trade-offs, the positives and the negatives? Do we secure better that side in the program that we're considering? At the moment, there may be other forms of assessment and risk assessment that will take place on those projects and programs, but they don't perhaps consider a structured approach to looking at the One Health side. Always adding value. Can we always do that? Well, not always, but it is a way that we need to think about everything we do, from treating animals through to developing new streams of work or policy advice. There are many barriers to One Health. There are many reasons why it's been difficult. Some of those barriers are the result of the complex and confusing terminology and what does One Health really mean? Is it a bit of a woolly, unclear topic? I think you've seen today there are many practical applications and many areas where we have to take into consideration. Do we have too many silos and barriers? Well, we still do. And most of our governmental organizations, most of our international organizations are built around those traditional disciplines, which are human health, agri-food systems, animal health, environment, and different ministries, different international programs tends to put us into different silos, even from, of course, our educational backgrounds. So can we do something better that will train us for the new work, the new jobs, the new way of working in an interdisciplinary way? There's also a transaction cost of doing work with people that you don't know, with new systems that you don't know well. That takes time to deal with, unless the reward is there for working together. There can be skewed power relations and competition. We know from One Health, some sectors have always seemed to have more resources. And that's been the history of why One Health has had difficulties. At the same time, the concept of equity between disciplines, equity between sectors needs to be brought in to our thinking as we work, and creating real rewards for collaboration and cooperation so there are less fights. One example I'd like to give is the work that we did together with also quite a lot of involvement of Norwegian Veterinary Institute to develop the progressive management pathway for aquaculture biosecurity. This is a pathway that really was created to help mostly in low and middle income countries that were dealing with wave after wave of new disease issues in aquaculture, starting with a risk assessment pathway, biosecurity, building up the national systems, and building them up until there is a maturity of involvement for the multiple agencies and stakeholders to guarantee ecosystem health as well as aquaculture health and human health, all at the same time. And that pathway's been useful because you can apply it really starting from anywhere to look at the risks you have and how you need to work together and have you put those dimensions in. So moving to the consideration about how we scale up this work. I mean, we've got these areas that we will be working on as priority programs in FAO. What is the question on all that we're thinking about very much at the moment is how do we ensure what is done and that works can be scaled up effectively to the countries that need it, to the global tools and support that's needed. Well, that's an area that we're calling the accelerators, and looking hard at what innovations are going to help that to happen, what technologies are going to make it possible to embed One Health, for example, in our agri-food systems. How will data available for the decision makers, including at the producer level, how will that influence their behaviors? And what will be the governance, the partnerships, the networks that were needed to make it happen? I think what you're doing with the platform in Norway is one example of trying to create a capacity, a dialogue, a discussion to build those things in, and we can only applaud and appreciate that. In terms of the what we're doing internationally to move forward, I've mentioned the global things we're doing together with our tripartite partners, working on a partnership platform to enable far more private sector, civil society, government stakeholders to interact on AMR. There's a need for a dialogue like you're having today on the major domains, also for the wider aspects of One Health. But those are at the global level. We are trying to influence international decision-making on financing health investments to include the One Health element, including our G20 leaders who've been recently meeting and considering what financing is needed really to improve our health systems, and have promised to include the One Health approach in their considerations. But One Health is also something which we need to do at the individual level. It's something we can do in our thinking, whatever our job is. Pretty much the actions that we do in relation to health decisions have trade-offs and balances, and they can also have some environmental impact. So do we bring that in adequately? Do we learn how to work with the other disciplines necessary to assess those risks and to identify the values? Are we also thinking about how we can ensure we can verify One Health through our value chains, so that the consumer, if they choose, might have a way to be able to better understand what they're buying, where it was produced, under what conditions, and the verifications relating to antimicrobials and other parts that might be that need to be into consideration. So new technologies may help us with that, so that we can be better and more conscious about what we do individually, but without adding barriers to those that need to participate in that market. So with that, we all have a role to play. One Health depends on our actions every day, depends on the decisions that we make. And I'm glad to see this day take place. One Health Day is a chance to sort of come together and talk about the things that we can do together, some at the global level, but very much at the personal level. And thank you very much for your attention today. Thank you.
So thank you very much to Keith for this lecture that makes actually a good transition to all that we talk, that we think should happen, that could happen, and now the hard question, how do we make it happen? And it's their time to have a discussion between all of you and some of us that have moderated and organized this session. And for that, I would like to invite Christine Brooks, who is an advisor at the Central for Global Health. And she's a medical anthropologist and currently working as an advisor to our Lancet One Health Commission, or actually she's the one that keeps sure that we actually deliver, and therefore the right choice to make sure that this debate flows nicely and within the time set. Thank you. Christina, the floor is yours.
Thanks, Carlos, and thanks everyone for joining us today and for staying with us during this closing session of the conference. As we've heard throughout the day, One Health, we believe, we know, offers a systemic, sustainable approach to some of the most pressing global health challenges of our times, from infectious diseases, emerging and endemic, to non-communicable diseases, from antimicrobial resistance to food insecurity and food safety concerns, as well as with respect to the very profound threats to health posed by climate change, biodiversity loss, and environmental degradation. This conference is a really important step towards convening and mobilizing the Norwegian One Health milieu. And that's exactly what we want to focus on in this roundtable discussion. One Health here in the Nordic context, in Norway specifically, where are we currently and where do we aim to be moving forward. So I'm going to invite all of you who are participating in this roundtable discussion to join us at this table. Christian, Carlos, Jeanette, Ingvild, Olgot, and Hannah as well.
People at home can follow up, which was what I was not doing.
All right, I'll speak to this microphone. So we'll aim to have a couple of rounds of discussion. Hopefully we can keep this a bit dynamic and go a bit with the flow. But I'll start by posing a distinct question to each of you, trying really to pick up on some of the key themes that have been taken up during today's conference. And if you can respond in 1 or 2 minutes, and then also we can have 1 or 2 minutes for reactions and dialogue from the rest of the discussants, that would be great. I'll address you by name and affiliation in this first round for the sake of anyone who hasn't been with us throughout the entirety of the day. So Ernst Christian Rødland, Senior Medical Officer at the Norwegian Institute of Public Health. As we heard from Carlos at the beginning of the day, these are changing times and One Health is gaining momentum. In recent years, and especially in the wake of COVID-19, a number of global One Health collaborations have mobilized, including, perhaps most prominently, as we also heard earlier today, the One Health high-level expert panel that represents the United Nations Food and Agricultural Organization, the World Organization for Animal Health, the World Health Organization, and the United Nations Environment Program. We've also seen a number of national, regional kinds of networks, alliances, One Health collaborations. These have really proliferated in recent years. So I'm wondering what you can tell us about what we've learned about the need for such kinds of collaboration here in Norway, especially perhaps in light of COVID-19.
It's a difficult question. What we have learned, I think, we are always talking about the need for collaboration, and I think that's extremely important. And what COVID-19 has made clear is that we still sit in our silos in a sense, and even though there are efforts to tear them down, I don't think we have succeeded well enough in doing that. At the public, I have been heavily involved in the COVID-19 strategies and efforts to fight the pandemic in Norway, and we have absolutely learned and had problems with, the collaboration across disciplines and also among different institutions and governmental stakeholders and so on in Norway. As you noted, I have been a little bit frustrated over many years, actually, that the medical community somehow has been absent in the One Health context. And I have to admit, I have been thinking, that's because we have not been invited in. But I think I've changed that opinion, and I think maybe it's because the interest hasn't been there. And maybe COVID-19 really has shown the importance of the environment and animal health, etc., for clinicians and people working within medicine as well. Maybe not at the Public Health Institute, maybe not among those very few microbiologists, etc., who are working on AMR, but among the great majority of medical doctors in Norway. I think, I'm a little bit long now, but I will finish very soon. But there's one thing I've been thinking also while I'm sitting here today. Why is this? Why doesn't the medical community in Norway have this interest in One Health? That is puzzling, and I really wonder. But maybe one of the explanations is what was shown in this very surprising result of the YouGo questionnaire that was published in 2019. And very surprisingly, Norwegians are among the least climate concerned people on the globe, only beaten by the US and Saudi Arabia. So maybe there is something about, the whole society, and that's reflected in the medical community as well. But I think collaboration, continue to work on that, to improve that, to tear down the silos. That is what I hope we have learned. I'm not sure, but I hope so. And as a result of COVID-19. Thank you.
Christian. Maybe I can just follow up on something that you just mentioned and something that was raised earlier today as well. This challenge related to the limited engagement among the medical community in Norway. Of course, there's a challenge there's a question of to what extent this challenge is unique to Norway or reflected as well in other nations and One Health endeavors. And I just recall that one thing that you mentioned earlier today, Carlos, was that we see in a lot of low and middle income countries a lot of One Health activity, right? There are national action plans that are developed and implemented, lots of capacity building, of course, and that's not the case in most high-income countries. So I know a lot of you who are sitting here have worked in a lot of these low and middle income countries on a lot of these capacity building projects, perhaps with some of these national action plans. Are there any lessons to be learned from your work around the world with respect to this challenge that you are yourself concerned about, Christian, or anything else?
Thanks, Christina. I think here there is a key element. It's the sense of urgency and of panic. And while we talk a lot about COVID, I'm a virologist. SARS is really a nice, cozy virus. I think the medical community in the country would be much more aware if Norwegian chickens start dying with high avian influenza. That kills humans. We will see a change. So I think what we experience in these countries is a true sense of we need this to make it work. We will not solve this problem unless we interact. And just speaking in something Christian today, for example, said, I'm also a professor at the medical school in Tromsø. And you said that we don't have space in the curricula for One Health. And I often, I joke a little with my colleagues and tell them it's really puzzling. We teach vet students 7 or 8 different species plus One Health. How don't you have time when you just do one? But on top of that, the medical course in Ghana has One Health. The medical course in Malawi has One Health. The medical course in Kenya has One Health. So they've realized there is an urgency. We're lucky not to have high pathogenic influenza. We're lucky not to have Coxiella running loose. The day we do, I think we'll get a little more people. But wouldn't it be nice if we could do that before those things arrive? So sense of urgency is a detriment for humans' health and probably for politicians, not the least.
Carlos. I'm going to move on to the next question. Hanne Jørgensen, senior researcher at the Norwegian Veterinary Institute. We also heard today that most infectious diseases originate in animals. So we know that 2/3 of infectious diseases originate in wild animals, predominantly in compromised habitats. And nearly all known pandemics are understood to have animal origins. So although COVID-19 has really epitomized the threat posed by infectious diseases that transmit between animals and humans, these diseases, known as zoonotic diseases, have for years, of course, been a central One Health concern. Can you speak to this, please? Where has the infectious disease focus been in Norway? And where should it be moving forward?
Yeah, you're right. The One Health concept actually evolved following the outbreaks of Ebola, BSE, HIV. The scares around that was what made the world community realize we need to be focusing our efforts in a slightly different way to manage it. In Norway, the north of the world, we've had a comfortable distance to all of this. We have been mostly working with much less dramatic zoonotic diseases, and a lot of them foodborne. And I guess that also affects our feeling of urgency, perhaps. We're not really used to managing the really severe zoonotic diseases that spread like wildfire in the human population. So, I guess this is partly because we have beneficial geography, we have limited borders, we have good climate, and also historically good public health and veterinary public health services that have done a lot of work to limit diseases. So I think that, so looking forward, you asked me, what have we done? How are we moving forward? Again, we're going to be bringing this up until you get bored. It's the collaboration. It's the working on our daily problems, to some possibly trivial problems, to us important problems, but we should be working with Campylobacter in chickens or MRSA in a way that prepares us for the more urgent matters as well. And I think that's how we should be moving forward, establishing the platforms so that we can actually respond rapidly and more efficiently when shit hits the fan. Yeah.
Thanks, Anna. Ingvild Vastesen, a professor of food microbiology and food safety at the Norwegian University of Life Sciences. Earlier today, you described food systems as one of the most important human-animal environment interfaces. Food systems are really at the crux of concerns about pathogen emergence and spillover, environmental degradation and biodiversity loss, food security and food safety, of course, and animal welfare. So how important, in your perspective, is One Health for sustainable Norwegian food systems?
Oh, that's also a pretty huge question with no simple answer. But if we think about the food systems and bring in two perspectives, one is food security and the other is food safety. So from the Norwegian food production, we have to be aware that Norway is actually we are a food exporter, taking into account aquaculture, food production as well. So we are a net food exporter, and I think we have to realize that regarding sustainability in our aquaculture, we have still a quite long way to go, both with regard to animal health and animal welfare, especially. But when we think about, of course, we don't live of salmon ourselves. So we will still, even though we are net producer of food, we still are heavily dependent on the import of food. And we've heard something about food safety and contamination of food earlier today, but I think that we don't know very much about the quality and safety of all the food that we import. For example, as Gro mentioned, we want berries all around the year, kiwi, avocados, whatever. But we don't know so much about the safety of these products. So that's something I think we need to have more focus on. And talking about food safety, I think it's also important. You mentioned, Hanna, we need to work with the diseases we have, although they are not very spectacular. We need to train and work on those to prepare for more urgent cases. And of course, there is also this debate about, I think it was Barbara Heusler from London who mentioned this the question about beef. Is beef production, is it a blessing or the curse? And we know that in Norway, Norway has only 3% arable land, and a lot of this land we only can grow grass. And if we humans have to eat grass, we have to take that grass through a ruminant. So how can we sort of exploit that resource in Norway and in a sustainable way. I think that's important also for exploiting the natural resources in Norway. So there are many questions, I suppose, regarding food security and food safety.
Thanks so much, Ingvild. Olgat Akra, Executive Director at the Norwegian Institute of Public Health's Division of Climate and Environmental Health. One Health governance is a really hot topic, from questions about how to govern One Health, so in other words, how to regulate One Health activities and the many things that now call themselves One Health, to really structurally transformative proposals for global governance in service to One Health. Can you please share your perspective regarding One Health governance in the Norwegian context?
That's also a difficult question. I entered the medical community only a few months ago. I came from NMBU, where I used to work with ecologists, and circular thinking, that's what I've been learned always, and I think that's very important also when talking about One Health governance. So collaboration has been mentioned here several times, and I think collaboration between disciplines in academia, between research institutes and so on, that's actually not the main problem. It's at the political level, among the ministries, across the ministries. That's where the problem might be. So I think there is, we have a mission to educate our politicians and ministries. Lifelong learning, that was a big task for the former minister, and I think we have much to do there, actually. I think it's very important that we express our thoughts and our knowledge about what plant health, animal health, microbiomes, human health, and all the biotic and abiotic factors affecting our lives and health. We must tell the politicians about it and include it in all kinds of policies and regulations we have. The collaboration between the environmental agency, Miljødirektoratet, and the veterinary authorities regarding the CVD is an example that we can probably elaborate on. So, yeah.
Thanks so much. Carlos das Neves, Director of Research and Internationalization at the Norwegian Veterinary Institute. We just heard from Keith Sumption that there is a need to embed more fully the environmental dimension of One Health. And although some of the global health challenges that have been addressed today have really been of central One Health concerns, such as antimicrobial resistance and zoonotic diseases, others, such as climate change and biodiversity loss, which have also arisen today, have more recently been taken up in One Health circles, particularly as holistic ecosystems-oriented perspectives have taken hold. So can you please speak to the importance of the environmental facet of One Health here in the Norwegian context?
Thanks, Christina. It is indeed the last one to arrive. There. It is indeed the last component of the One Health to arrive to the stage. I mean, even UNEP has been the last one to join the tri-party. So it shows that there is always this decalage, and it also represents decalage in funding, in focus, in interest, and in making a case that it's important. Climate change tilts the scale here, because it's an easy example that environment has an impact on diseases and on health. But we all enjoy holidays in sunny beaches or beautiful clean fjords. We all want to eat food from an environment that is safe, that is clean. So in Norway, perhaps, where we perhaps don't struggle with some of the environmental challenges many other countries do, and we don't have so much, some people think, climate change challenges. I think Dag has illustrated that's far from true. We do need to look into this different. And that means that we need to learn to break some of these silos. And Olga was just saying that it's not so difficult between us institutions. Probably not. Though we're very territorial. Don't touch the environment because Nina owns it, and I tell you don't touch my animals because it's me. And we're definitely not going to start touching our humans. Perhaps we need to be a little more friendly to each other. That said, we do have 3 ministries above us that are... let's be politically correct, not very prone to sharing either responsibilities or even more funding. So the big challenge for environment is for that topic to find its place with us, among us. And it's perhaps our job that have been longer in One Health to welcome them, not trying to just divide their topic among us.
Thanks, Carlos. Jeanette Magnus, you direct the University of Oslo Center for Global Health, which is an interdisciplinary hub that's dedicated to capacity building in global health, education and research, as well as to advancing progress on the Sustainable Development Goals, which we have just heard from Keith as well, One Health is. So how relevant is One Health in this regard? What is its place at the Center for Global Health that you direct?
Thank you very much for the question. One Health is very relevant. Simple question. Does it have a place? Yes, it does. And global health is usually thought of being very narrow, but in a way it is including both One Health and planetary health in its broad definition that we are working hard to operate. I can understand Christian's frustration that the medical profession is a little unsure about One Health because it is not in the curricula. If you look for global health in the curricula at the different medical schools in Norway, you might find a week, you might find perhaps 2 weeks out of 6 years. So it's not adequately integrated there either. So for me, One Health is very important because I lean myself on a quote that is usually attributed to Albert Einstein, where he says, "We cannot solve our problems with the same thinking we used when we created them." So ladies and gentlemen, what we see today is a ton of problems that we, within global health, within One Health, within planetary health, we have created a lot of problems for ourselves. So we need a new framework. We need a new way of thinking in order to solve all these questions that are there. And the Center for Global Health is putting up as a banner for our work Einstein's quote, and we are trying to see how can we, in a transdisciplinary, interdisciplinary, multidisciplinary way, get rid of all of silences. And that's why we're sitting here today, because we think this is of the uttermost importance to support people changing their way of thinking. Did I answer your question?
You did. Thanks a lot, Jeanette.
Thank you.
And actually, thanks a lot to all of you for a really insightful round of discussion. Time's moving quickly, but we have some minutes remaining, so I want to give you all a follow-up opportunity to really summarize from your unique positions of expertise. And some of you have already begun to do so, so perhaps elaborate or diverge if there's more. But to really summarize from your unique position of expertise, one key challenge that impedes One Health progress in Norway, as well as, if you can, one example of where there is One Health progress and opportunity here in Norway. So in other words, where is there a need for strengthening One Health nationally, and what are we already doing well? How can we come together across disciplines and sectors to continue to advance One Health nationally? Why don't we just go in the same order that we just did? So Christian, you've shared insights regarding the current profile of One Health collaboration nationally. So please, one challenge that impedes progress in this regard, and one example of progress or opportunity.
Well, I think I touched upon it what I said previously, and the key challenge is ignorance in a sense, and that doesn't get enough attention. And the solution, potential solution, that's what we do here today. And what you said, Hannah, we're gonna talk about this, or I am going to talk about this. Maybe not this audience will be bored, but I think maybe other people will be bored. We just have to repeat it and continue to work on sort of lift the issue. That is what I can say today. Thank you.
Hanne, you've shared your insights regarding infectious diseases, of course. What's one key challenge that impedes progress, key opportunity or progress?
Framework. I think and that needs to be top down, bottom up, both. We need our institutions to expect us to be working within the One Health framework. Our politicians and our institutions should be requesting us to do it. All the relevant institutions should be doing that. And at the bottom, we should be trying to move outside our comfort zones, meet people colleagues from other disciplines who we might not actually understand that well, find out how they work, what are their methods, and respect their methods. That's how we're going to establish future collaborations. I'd actually like to know how many social scientists are here today. One? Two? Yeah, that is our challenge. We are a room full of natural scientists, and we need more of the social scientists in with us. So next year, there'll be more hands.
Yeah, I'm really happy that you mentioned that because, of course, a lot of focus does go to the challenges associated with engaging the medical community, but there is a lot of progress, as has been mentioned, perhaps not the same kinds of political challenges in terms of interdisciplinarity, but quite a long ways to go as well. Ingvild, you have, of course, shared your expertise regarding food systems. Would you like to summarize for us a key challenge and/or opportunity?
Well, Christian and Hanna has drawn up some general perspectives that I, of course, agree totally with. But I would like to point to one more concrete example, maybe, or concrete challenge when it comes to Norwegian food production, animal food production, and that is to provide our animals, both land-producing animals and also aquatic animals, with more sustainable feed than we do today, to be less independent or less dependent on imported feed for our food-producing animals. I think that's an important aspect that we need to address. And I know there is a lot of sort of projects innovation going on in Norway that we need to support and develop to change the feed sources to more sustainable sources than cutting down the rainforest in Brazil and import soybeans. So that's a very concrete example for me.
Thanks a lot, Ingvild. Ågot, I'm going to return to you. You've underscored already challenges related to politics and governance. So perhaps you want to elaborate more specifically on that, or tell us something else that you think important with respect to this.
Well, Carlos, you mentioned 3 ministries. I think we could add at least 5 more.
Absolutely.
So, and I'm not of the opinion that the collaboration between academics and across disciplines is easy, but researchers, they can be forced by their rectors and their leaders and the politicians. But how do we force the politicians to collaborate? That's voting. Yes, that's voting. So, but I think there is. I think we should appreciate a lot of the initiatives from the Research Council, where they have forced researchers and industry to work together on large problems, societal problems. You mentioned the sustainable feeding of animals. There are several projects invested heavily in by the Research Council and these projects, they give results. And I think we could perhaps make our politicians to work towards the research funders on also One Health perspectives. We are, when we prepare applications, research applications, we are forced to discuss responsible research and innovation. Why don't add One Health in these considerations? That could be something. So I think there's hope to go on and also let the politicians understand the importance of the One Health perspective.
Indeed, thanks so much. Carlos and Jeanette, we'll wrap up with the two of you. Any key challenges or opportunities that you would like to underscore? Carlos, any final reflections?
On a challenge, one that is for once an opportunity. Challenge has always been timing. The world is always faced with bigger problems than this. For once, perhaps a unique time in history, this is the biggest problem. So the challenge of be at the right spot at the right time is now an opportunity. A little covering session on the biodiversity. Just one more thought is that, and I'll mention it as we close today as well, we also need to bring into the equation everyone that needs to be there. And I would highlight here that for things like biodiversity loss and land use and land change, the private sector is a driving force, business. And we're happy that we have here Bondelag and Animalia, and probably many more will join in, we hope. But without them, it's not just about fortune politicians. People that live and prosper from lands and from natural resources, they need to be on board. So that is a driving force into the future.
Thanks a lot, Carlos. Jeanette, any final reflections from you?
Thank you. One of the great things that has happened lately is that Global Health Norway, which is a board that where all the medical schools and Folkehelseinstituttet and helseforetakene in Norway is participating. They have initiated a process on identifying what are global health competencies for health professional educations and health professional workers. And One Health is in that framework. So that is a good thing if it ends up going through all the way and becoming what it is today. A challenge that actually also warrants at least many of those politicians that you worked on, that you have mentioned, is actually the system and the structure for financing research in Norway, where you actually have silo funding. You're not honored within the Norwegian system to be cross-disciplinary. There is very clear allocation of funds and revenue from the government to the different higher education institutions and the institutes based on research and so on, that actually promotes the independent researcher and promotes working within your institution and not between and across institution. And I think for a field like global health, like One Health, we need to actively work on the structure for the funding stream as well, so that it benefits us and gives us the opportunity to continue this kind of very interesting, highly needed research and education that we are doing together.
Thank you, Jeanette. Thank you to each of you for a very informative, inspiring conversation, for what I think we can all agree is a quite compelling call to action. On that note, Carlos, I'm going to hand over to you and invite you to further the discussion of this vision.
I hope they put on the right slide, which is not this one. Or have they? They'll change it and put the presentation. So we're almost there. But by saying we're almost there, it means that the 3rd of November and this One Health conference is soon coming to an end. So the big question, if it shows up on the screen, is how do we move forward? Or shall we just meet again in 364 days and keep it going? And a lot of us think that we shouldn't just save our energies and meet again in 12 months. We should try to change things. And, well, let's see if things change. Like a presentation. There we are. So, Quo Vadis, where to One Health Norway? And I think at the end of this day, we've heard from young scientists to fully well-known scientists that there is a lot to do, there is a lot of attention. Global health and One Health is a hot topic. This is just Google metrics showing how often people Google One Health. So if you're working One Health, we are popular now. If we're going to be popular in 1 year, remains to be seen. But trying to go away from the Venn diagram for once, I would say that this is a lot of what we've been talking here today. We need these 4 pieces of the puzzle to come together. But so far, if I could characterize each of these pieces with one word, I would say that we've had a political leadership that only reacts after it explodes. We have a society that has for the most not been interested. You just mentioned we're not climate oriented here in this country. We have a private sector that has been perhaps unconvinced that this is so important. COVID has changed that. And we have a strong research and innovation that has been, as Jeanette was just mentioning, highly underfinanced. And I could have added here also the word that spends a lot of time quarreling among themselves. So we need to get these pieces of the puzzle together. And that is exactly what the 4 institutions that brought up this conference today hope that we could do now. And doing that by having a structure that lasts a little longer. And you know, the Americans have organized themselves to have a strong One Health Commission. This is their website. It's a gigantic infrastructure. I was amazed. Africa has just launched their One Health Center. I was impressed. The Dutch have the Dutch National One Health Center. I was jealous. And then the Swedes also have it, and then I got pissed. And that motivated us furthermore to say that if they manage, so can we. And that is the mean that this conference, we wanted to have a snapshot of what is happening. I know for most of you it was challenging to speak in 7 minutes, but it was just a snapshot, a taste of a lot that is being done in this country and by people in this country abroad. And now we want to challenge all the institutions to stay on board into what we would like to call a One Health platform. An arena, a virtual space, if you want to call it like that, with very simple goals, but perhaps very ambitious. To mobilize all of you and more to join us. Private or public, academia or politicians, journalists or people on the streets. We want to have a focus on these ambitious national problems we have on the animal side, on the environment side, on the public health side. We want this platform to help us map the initiatives. As I mentioned, we just had a snapshot of what is being done, but I can only imagine that this is really a drop in the ocean. We want to establish this network also as a cohesive partnership. And someone was mentioning here exactly, perhaps go together, as a consortia. I just came from Africa, where 4 Norwegian institutions were at the same country, all paid by the same agency, and with 0 collaborations among themselves, and all there at the same time doing One Health projects. So we do have something to do here. And last but not least, to help guide, influence, and perhaps lobby for a topic that we are all passionate. How we're going to do this is to now send an open invitation to several institutions that we believe have One Health relevant activities and invite them to join us on this core group of 4 institutions for the next few months as we develop this strategic plan for this platform. Because we've promised these 4 phases that we will meet them later in 2022, in the spring of 2022, to discuss this strategy plan with them. And by discuss, I mean beg for money. Because most of the other fine examples you've seen here have actually ongoing secretariats. And we're very lucky that the Global Health Center here has been the secretariat for this conference, but they too have more things to do than people they have. So this is something we need to address. But at this point, the politicians want to have a blueprint of what could such a network do. So we are 4 that have said yes. We are presuming that those that agreed to be in the scientific committee are not so badly impressed after today that they will leave. So we hope these ones will be on board, but there is space for more. And that is to say to all of you that I want you. And here using the Viking, I want you. And I would call your attention that this Viking is actually a One Health supporter. He has the damn Venn diagram on the eye. And for all of you that have managed to stay here so long, we have a reward. We hope it's a reward. We thought that as we invite other institutions, some of these rectors out there might not be very familiar with One Health. So we thought, let's produce a quick educational material to help get people motivated into One Health in Norway. And we decided to go for a video. So you are all invited to this unique premiere of editor extended cut, because the video at the final format will be a little smaller. But you get a chance to be the first ones to see how we've tried to explain One Health in Norway. And for those of us that participated, this is also a chance that if One Health in science doesn't work, we'll move into the film business. So without further delay, I leave you with this film, and I thank you, all of you, for attending, and I hope you will join us in this national Norwegian One Health platform. Thank you very much.
My name's Christina, and I work with One Health, a holistic approach to health and sustainability grounded in scientific understanding of the interconnections between human, animal, and environmental health. One Health has been around for many years, but as Victor Hugo said, nothing is more powerful than an idea whose time has come. In a world transformed by COVID-19, we've awoken to the need to do things differently. Sicknesses originate in wildlife and transmit between animals and humans. The pressure we exert on wildlife habitats exacerbates this risk and jeopardizes the diversity of life that our ecosystems contain. This compromises, among other things, our discovery of new medicines, which is especially concerning given that many of the medicines that we currently depend on are increasingly ineffective, a crisis known as antimicrobial resistance, driven by overuse among not only humans, but also livestock and even plants, as we struggle to feed the increasingly hungry and food insecure world. Pandemics, antimicrobial resistance, food insecurity, biodiversity loss, and climate change, these are unprecedentedly complex, interlinked, and rapidly escalating global health and sustainability challenges. They surpass the scientific expertise of any single discipline. They exceed the mandate of any one sector or governmental ministry. They threaten us all. Join me on a One Health journey as we come to understand the human-animal-environment interconnections that underpin these challenges, as well as their solutions.
Hi, Christina.
Hi, Carlos.
Hi, kids.
Hi. We were just out enjoying the beach today and talking about how important the health of our oceans is. Can you tell us about that?
Absolutely, and you're right. They are super important. I mean, this is a unique environment, a unique ecosystem. It's most of our planet. Plants, fish, algae, sea mammals, the biodiversity that the oceans inhold are central for us. And as we are more and more of us here on the planet, we need, for example, more food the oceans can provide. We might need new drugs as antimicrobial resistance develops, the ocean can provide. We have energy. We have so many resources in this unique ecosystem. And even if you think about economy, look at our fjords and the tourism industry that depends on the oceans. And at least for me and perhaps for the kids in the summer, when we're tired from work and we want to de-stress a little, the oceans give us that chance for a nice dip. So yeah, the oceans are central.
Are we at risk of losing any of this?
Unfortunately, we are, perhaps now more than ever. And we don't need to think very far to illustrate this. Think about pollution. Sewages from both us and livestock going in the water. Think about plastics, toxic things on the water. But also not forget about climate change and how that impacts our oceans. It's not just about glaciers melting down. It's about new infectious diseases going on the water. It's about invasive species. You know, we have the Pacific oysters just along our coasts. It's about so many changes. It's about us also, unfortunately, harvesting these resources too quickly. And if we don't do fisheries right, and if we don't do aquaculture in a sustainable way, we put all this at threat. And here in Norway, we are very strongly focused in being on the front of the United Nations Oceans Decades. So if we want to lead the way, we definitely need to take care of this environment, which affects you, me, everyone. So it is One Health and it is under threat.
Absolutely, Carlos. Thanks so much for explaining all of that. We sure are going to keep getting out here as often as possible, and we're going to do everything we can to take care of our oceans.
Thanks a lot, Christina.
Let's go.
Hi, Christina.
Hi. So here we are at this beautiful farm in Maridalen outside of Oslo, but there are no food-producing animals here like sheep, cattle, or pigs. Ingvild, can you tell us why?
Yeah, and the reason is the big lake that you probably observed on your way here a bit further down the valley. That lake is actually the main drinking water resource for the population in Oslo. So we know that animals can carry different microorganisms in their intestines that may cause disease in us humans if they are transmitted to us through contaminated food and water. And that's why we need to restrict the number of animals in the catchment area of the lake to protect the drinking water quality for Oslo's population.
I see. So what else do food systems have to do with human-animal environment interconnections?
Food systems are implicated in a number of urgent global health and sustainability challenges. Foodborne diseases are a major cause of death and disabilities in the world, and we're all threatened by resistance to antimicrobials arising for the use and overuse of antimicrobial drugs to both humans and animals. And we know that both food insecurity and hunger are arising, while at the same time about 1/3 of all the food we produce each year is lost or wasted. Another challenge is the conversion of land to grow crops and provide pasture, which causes deforestation and loss of habitats for wild animals. And this is one of the main risk factors for the emergence of new infectious diseases and new pandemics.
Oof. So can One Health help?
Yes, One Health can help us. One Health can help us understanding the human-animal environmental interconnectedness, which is at the heart of our food systems. And One Health can then help us feed the world in ways that are both sustainable, healthy, and equitable.
That sounds wonderful. Thank you so much, Ingvild.
Thank you, Christina.
Hi, Christian.
Hi, Christina.
So today we have been to the beach and visited the ocean. We've been to the farm and we've seen the animals. And now here we are in one of the most rapidly developing areas of Oslo. Can you tell us about where the human-animal environment interconnections are here in the city?
Yes, that's a very good question. And I think many people believe that nature is more or less absent in an environment like this. Globalization and urbanization in the 21st century is one of the biggest threats to human health, actually. And the vast majority of people in the world live in cities. So they are facing new health challenges compared to previous times. You can say that it's a triad of challenges. One is, of course, pollution and lack of access to clean water. It's poor hygiene. Not in a city like Oslo, but in other big cities around the world. Also, cities are perfect habitats for development and spread of new infectious diseases, what we call emerging infectious diseases. And COVID-19 is the most recent and relevant example of that. But also in cities, people are more exposed to injuries, violence, accidents, traffic accidents, which is a challenge to human health.
Are there also any opportunities here in the city?
There are opportunities, and this is a perfect example. In this area of Oslo, there are a lot of efforts and projects that try to build what we call green rooftops, that is to actually make gardens and green areas on top of new houses, but also green facades, that is to actually put plants and grass on the facade walls, both to improve the environment in the sense that the air quality, but also to give people more the feeling of being in nature. And also I want to mention that Oslo actually is a bike-friendly city, or has become a much more bike-friendly city than just a few years back. And biking is good for health, and it's good for the environment and for the air that we breathe.
Sounds like One Health can really help us to understand the risks involved in urbanization, as well as the opportunities to urbanize in healthful ways.
Absolutely. One Health is also relevant for people living in cities.
Thanks so much, Christian.
Thank you.
Thank you all for joining today and for such wonderful conversations.
Thank you very much, Christina, for our chat on the oceans. Environment, biodiversity, natural resources, these are all central key things for us, for our health, for our economies. So yes, the environment is One Health.
Thank you, Christina, for looking into the animal and associated food sector. By using a One Health approach, we can develop sustainable food systems without compromising animal health, animal welfare, or the environment. So it's all One Health.
Thank you, Christina, for looking into the urban world. Globalization and urbanization are reality, and in that sense also One Health.
I see the need to connect all of you, to connect people and knowledge, sectors and disciplines. One Health Norway aspires to be exactly this platform for collaboration and networking, a place where scientists, private sector actors, policymakers, and government agencies can exchange knowledge and experience, negotiate priorities, and together conceive integrated solutions for the challenges that impact us all. This can help Norway to fulfill its commitment to global health and sustainability agendas and to our next generation. This can help Norway to be a country where all of us, people, animals, plants, and pristine ecosystems, can live and thrive as one in one healthy socio-ecological system.
So thank you very much. We have technically on the program, if there's any questions regarding, not the movie, but the platform. The movie is on its way to Cannes. But on the platform, if there's any immediate questions that we can answer. Otherwise, yes, there's one there. Just put the, I'll just, yeah.
Thank you.
See if it, yeah,
so you talk about involving private industry partners in One Health solutions, and I see how it's motivated by reducing siloing. But have you considered how there's a risk involved with involving partners when you have, especially involving lower middle income countries, as well as other power differentials that exist in our own country, and how that difference between stakeholders that might represent a private industry versus others could actually be a problem for those individuals whose health and community is being impacted by the One Health initiative, and that the One Health initiative is supposed to be part of all initiatives, and that gives private industry access to community issues.
Thank you for your question. It's always nice to move a little into the politics and lobbying, and we probably don't have here time today to go into a lot of it. First, just on the platform. The platform is a Norwegian initiative to focus on the Norwegian reality of One Health. Which of course translates that a lot of us, especially in the academia, but also in the private sector, are engaged in activities outside our borders. When it comes to how we do this collaboration, there is an importance to have the checks and balances in place. There's a lot of people that are a little skeptical of strong involvements with the industry because they have their agendas, their interests, but at the same time, these are the main drivers for change, both on the financial capacity they have, but on the mobilization of resources. So we do hope that within the platform, which is first and foremost thought as an arena where we can meet, we can know about each other, and we can communicate. It doesn't mean that we need to agree and that we all need to go together into actions. And I'm supposing that especially when we talk that the platform can have politicians, I'm quite sure they're not going to be joining us for actions that often. But I hope we can find the space for an open dialogue, keeping, of course, a few checks and balances in the responsibilities, duties, and expectations of all parties. At least within Norway. Situation gets a little more complicated, as you mentioned, if we move abroad.
Huh? It works. Does it? Okay. Anne Kveimli, I'm a physician by background, but social scientist, a historian working with anthropologists. And I was so happy when Hanna brought up this question of social science, because I've been engaged in this topic during the last 5-6 years, and working with colleagues internationally, and in conferences like this in the UK or in the Netherlands, you would have social scientists included. So I guess my question to you, and I know of social scientists working in Norway who do not necessarily think of what they are doing as One Health, so I understand it's difficult to find them for you. But I ask everyone in the organizing committee to think why they did not think of social scientists. I want us all to think why social scientists are not that active in this field in Norway as they are in other places, and I ask the platform what thoughts you have for and what plans you have for including social science, because international research have shown that social science is crucial for exploring the political, sociocultural, economic aspects of this, given the complexity of the problem and the equity issues involved.
Thank you very much. I'll be a little careful to say what the platform is going to work. I don't speak for a platform that is still being built, so, but I can tell you a little what I think. Number one, no, we didn't land as much. And this perhaps represents the exact problem, that it is a challenge to engage with this. There was an open call for abstracts throughout the country. Well, we've received those that we received, that we analyzed. So we see a lack of there, which, as you mentioned, might be due to the fact that some people might not understand how central they are to these issues. And when we talk about social, I would actually say social and economical sciences. That's another aspect we thought perhaps to bring already into this conference. A lot of this costs millions, but risks losing billions. So as Hanne said, I hope next year we will have motivated more, and at least for the platform, it is my hope that we engage with all constituents of One Health, which are far more reaching than just natural sciences. Perhaps I would say the reason natural sciences has not succeeded, that One Health has not truly succeeded, is that we haven't reached out to some of the social sciences and to some of the money people. Jeanette, let me just look at, yes, I have 3 more minutes before I need to shut up.
I'll just respond to Anne. Because you were not here this morning when I explained that in order to organize this committee, we invited all the universities in the country to forward any researcher that they had. So everyone was invited to participate, but as Carlos showed, he showed the ones who came forward. But I think it's just like you said, people don't link it to One Health, and there we have an educational. So, but I know you have a few minutes, but please, those of you that have reflections to the video, please share it, either with one of those that you saw on the video, or send the Center for Global Health an email. Thank you.
Absolutely. Any more questions? So as I mentioned, we will now challenge again academic university institutes, so research institutes, as well as some other partners that we believe, I mean, we have, as I mentioned already, 2 here that have been strongly engaged in One Health, albeit perhaps more on the animal side, but I'm sure there are plenty more. And we'll at least invite everyone to bring in ideas. We will inform how we're going to develop. We can't have 100 people writing a strategic plan. It's just not feasible, even in Google Docs. But we would like to get as much input on what should be the components of this platform. Some are more educational oriented, some are more lobby oriented, some are just to put out information. What do we need? Where do we start? How do we combine this? So if there are no more questions, just again, thank you very much from me, and a special thanks to the people that have stood behind all this organization and to whom I give again the floor to close today. But I really would like to, on behalf also perhaps of FOE, who is here, and NMBU, thank the University of Oslo and the Center for Global Health. I mean, Gabrielle is here, and Ingeborg and Jeanette and Christina. They've been, and some of the new staff I just met, but who have been tweeting fractiously and keeping us, keeping our hashtag popular. Thank you a lot to all of you. This would have not happened without your commitment. Thank you very much.
Thank you very much, Carlos. And thank you very much to all of you that has been with us from home today. We really appreciate your stamina, and particularly thank you to all of you that have stayed with us all day here. Before we close, I want to go back to where it started. It was that the Center for Global Health at the University of Oslo is the host and actually is the core organizer for the Lancet One Health Commission. And as you heard from Dr. Andrea Winkler this morning, she's co-leading that commission. Throughout the whole day, we have had 3 commissioners in the room, and Carlos das Neves is one of them. Christina Brooks, that you also saw as the person that was interviewing on the film, she's another commissioner. And the third commissioner that has been in the room all day is Sandeep Sathai. So please, could you wave so that we see you? Thank you very much for staying with us and for all the things that you have contributed. In addition, there are 2 researchers for the commission, and that is Ingvild Vasteson and Christian Rødland. And then it's the person who is the nav, or actually at the center of the wheel, making everything spin and go around, which is Ingeborg Håvarsson, who's the administrator, managing director for the Center for Global Health here at the University of Oslo. She's also the person who has pulled together this conference together with Gabriela Rodriguez, with Laura and Brenda, that I think left us a little earlier, and of course Christina, that wrote the manuscript for the film. So that's why, please send us an email. And for those of you who do want to be a part of this, go to your institutions if you work at university, because somewhere in their mailbox is an invitation. So check it out. If you work in a private agency, another institute, go to your institution and say, I volunteer to represent you in this, because we are gathering institutions for the platform, not only people. There is a lot of actively engaged people, but we really believe that we need to get the institutions on board if we're going to precipitate change. In addition, all of you have familiarized yourself with the website for the Center for Global Health, being here today, even watching us. Go on the website, check that you want us to send you newsletters and information, because then you will get to know all the things that's going to happen. 2022 is going to be, One Health is going to be a big banner over all the activities we have. So, another thing that you need to do is go and see the poster slides that are on the website, so that you see the posters of all those that submitted their abstracts and research that did not get an invitation to present. And to all of you that worked and presented today, Thank you very much. We really enjoyed your presentations. And for those of you that didn't get a presentation here, perhaps in 2 years, we will do this again, and then welcome back. So without further ado, I would like to say thank you to all of you, and have a good evening.